Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with the weekly podcast. Actually, I'm going to call it a bonus podcast because I'm going to play it a couple times. It's appropriate because I have a respiratory illness right now. I'm in day 3 of my respiratory illness. If you've looked around, everybody's sick right now with a respiratory illness, whether it be COVID or flu. There's a lot of flu A going around. There's some strep, RSV I'm not so sure about. But there's a lot of stuff going on right now. It's New Year's Eve, podcasting this. It's really day 3 of my illness. And the reason I'm coming on with this is because of a few things I believe in from treating this for most of my life, for 38 years of my medical practice. Of course, that's what we treat a ton of, especially this time of year. And it can be pretty miserable for people. So that's why I want to bring this to you. It's very timely. There's a lot of people that are very sick out there right now. And that's not to mention what happened 4 years ago, when it actually was the last time I was sick at all with even a sniffle. Was 4 years ago with a case of COVID. I did very well with that because I treated it early, and that's why I'm going to talk about treatment early in respiratory illnesses, because too many people wait too late, and it seems like the last few days I've been mopping up a lot of work that should have been done 2 or 3 weeks ago by some of these clinics that people go to. Seems like they go in with a runny nose, cold, they feel miserable, they may have fever, they have cough, and they say, well, this is a virus. There's nothing you can do for a virus except go home and maybe take some antihistamines and chicken noodle soup, which I do like chicken noodle soup for this. They really don't do much for them because they usually do a quadplex or a fourplex test on them, which you can get out in the parking lot at Markham's Pharmacy. I don't know whether some of the pharmacies in my Knoxville area do this or not, but where they just swab your nose and they can tell if you have COVID, RSV, strep. The other one I can't think of right now, of course, is flu A and B. It differentiates that. Now, in my office, I will test for flu because I think you need to know that early, because sometimes I'll use Tamiflu. There's also some natural things you can do for it as well. But sometimes, depending on the patient, I will use Tamiflu if it's early on, within the first 48 hours, and they maybe has risk factors or they're elderly. But so you can tell, usually it's going to come back negative for these, and they're going to say, go home, or you do have COVID. Do you want to take Paxlovid, which I don't use much for COVID, unless it's a really elderly person who's immunocompromised, has a lot of comorbidities. I will use that one occasionally. The problem I've seen with that one is the rebound. 2 weeks later, they can get it again a significant portion of the time. So I really don't use that for COVID on most any of my patients. Unless they really request it and want it, I will. Again, remember, this is the patient's decision. Medicine is opinion, it's experience. It's, as doctors, we're coaches. It's your decision. I'm a firm believer in that. I don't say, me doctor, you patient, you do what I say. I don't say that. I'll work with people. I try to give them very good advice, too, from a lot of experience. But early treatment is really important, I think. I think it's just so important that you treat this early to prevent it from going into pneumonia. Because a lot of these people that I've seen, even young people, actually, they haven't been getting better from whatever they've been doing. I'll see them and I'll send them down for a chest x-ray and they have pneumonia. So I get very aggressive with their treatments at that point. But I also like to be fairly aggressive early on. I learned this during COVID, and I've seen it for many decades before that. I can remember personally back in the day when, before I started taking a lot of vitamins like I do now, I used to, 2 or 3 times a year I would come down with sore throat, sinusitis, bronchitis. I mean, the average person gets, I think, 5 to 7 colds a year. So, and I used to as well. I guess my immune system's probably better now, mainly because I eat better and I take a lot of vitamins. And one reason I'm in here in my home gym, in my basement gym, is because I still work out when I'm sick. a lot easier, but not my heavy workouts. But also going to my infrared sauna and sweat it out really works good. There's a lot of things that I'll do to get this thing knocked out, but I've come to the conclusion many years ago to treat early. Because remember how we're taught that a common cold is a respiratory virus and there's no cure for it? Well, that's kind of not real clear, because many times, and maybe you have this happen to you, it starts out as a clear nasal discharge or dry cough, and then it quickly turns into something worse, like green nasal discharge, coughing up mucus plugs, and getting short of breath, and fever, and having all that problem. So a lot of times bacteria get in on top of that. Years ago, I finally came to the conclusion that if I started a Z-Pack on day 2, on day 3 or 4, I'd be way better, practically cured. If I didn't, I'd be sick for a week or two and miserable. So I started thinking, I think these Z-Packs, Zithromax, really works for a virus. It wasn't until years later during COVID when I realized this was true. And there's another aside story I will tell you, a story about my dog Izzy. About 6 months ago, Izzy came down with a large wart on her lip. Very large wart, wouldn't go away. So I told my wife to take Izzy to the vet to have it taken off. It was really kind of hideous looking, and I'm sure bothered her. So I figured she needs to go to the veterinarian and get the wart cut off or burned off. And so I come home from work that night, and I asked Jenny if they took the wart off of Izzy. And she says, no, they said it was a virus, which is true. Warts are caused by viruses, and that they had prescribed a medicine, an antiviral, for her. And it was down at Max Medicine Mart. So I went and picked it up. Guess what it was? A Z-Pack. So I told my wife, this Z-Pack is not going to work for this wart. You know, I know it's caused by a virus, but this Z-Pack is not going to cure that viral wart. But I went ahead anyway to see what would happen, as I usually like to experiment. And sure enough, in a week, that big wart was gone. Further proof that Z-Packs, I think, help viruses, despite what you may hear. So usually you don't want it to develop into bronchitis and then pneumonia, and you stay sick for 2 to 3 weeks and miserable, missing work, everything else. So, and you actually know, if you're an adult, you know what's going to happen to you typically. You know how your body responds. You either kick this stuff in a few days on your own, maybe by taking supplements, or you end up on antibiotics and steroid shots, everything else. I mean, you kind of can think back and see how you've done both ways. But anyway, you know, and again, I'm a believer in natural healing. I think our bodies, if we have the right immune systems and take the right vitamins and are healthy, then you're going to fight these things off. But I also think that most people aren't equipped to do that, and they need a little help if they want to get over it quickly, and most people do. And they don't want to take that chance of having pneumonia and ending up in the hospital. Look what happened during COVID. We treated early there, and we're very, very successful with our treatments. So what do you do if you come down with something like this? What typically will I do? You know, if it's the first day and they just have a runny nose, is taking high-dose vitamin D, vitamin C. I get on ivermectin. I'm not afraid to say that word anymore. I get on my immune formula, which is a combination of D, C, methyl, B12, methylfolate, zinc, quercetin, and NAC, N-acetylcysteine, which works really well. I have this in my immune formula. And again, if I'm not better on day 2, I go ahead and start a Z-Pack. And then I'm on day 3 right now. As you can tell, I still got a little hoarseness, but I feel way, way better than I did yesterday. So I'm not totally over it, but I will be. So I started a Z-Pack last night, and I'd say in the next day or 2, I'll be totally back to normal. I drink a lot of fluids. I get in my infrared sauna. I still work out, but I take it easy. And if I'm not getting, I usually get better, but if my patient's not getting better, the next step really is to give them a shot of Celestone. I used to call it my snot shot. Now the antihistamine is a little oral liquid I give along with a cc of Celestone. And a lot of times that turns them right around. And sometimes if they're really sick, I'll give them a shot of Rocephin. And again, I'm not afraid of using a Z-Pack. It's a mild antibiotic, hits a lot of respiratory bugs, including mycoplasma, which I usually don't test for. I usually know what I need to test for. And like strep, I need to test for. Flu, I usually test for it. The other stuff like RSV and mycoplasma, COVID, I don't even test for it. I don't trust the tests that much, and I don't need them because I'm going to treat this anyway. If they get worse, of course, I can always send them for further testing, but it just usually doesn't happen. Occasionally, I have to send somebody for a chest x-ray and give more than one dose of Rocephin. My dad, who was a physician, always told me that a shot usually works better than a pill. And for somebody that's really sick, a shot does work better. I love the Celestone snot shot. It really helps you. I got one of those yesterday too. So I do this. I can reserve heavier antibiotics for later if they don't get better, but they usually get better really quickly with this if you start early. If I don't, I'll be sick for a week or two. And again, usually I don't get this, but right now it's just particularly rough. There's a lot of this stuff going around. And I'm a healthy guy. And a lot of people that are older with comorbidities, you really have to keep an eye on them because their immune systems aren't good. Occasionally, I will use IV vitamins on them. IV vitamin C, Myers cocktail. Fantastic for you. So sometimes I do give shots. Sometimes I do IVs to make you feel better. But the whole point of this thing is get treated early. You can even call our office. We do a lot of telemedicine for this, and we'll tell you the appropriate things to do. Call your medicine in. If you're not getting better, I'll tell you to drop by just for a Celestone shot and maybe sometimes a Rocephin shot as well. Stop by the office. But listen to your body really closely. Know your history. Like Bob Dylan says, listen to yourself. But take some really good advice from me is you need to treat this thing early. You know it may start out as a cold, but it can get into something a little worse. So now's the time of the year. Don't hesitate to call us for one of these things. And I hope you feel better if you have this like I do. Thanks. I'll see you next week.